Hospitals slow down on weekends when physicians and other healthcare workers are in shorter supply than during the week. For hospital staff, that may seem natural, but from a patient's perspective, the day of the week has no bearing on symptoms or the need for a consult or surgery. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Perri Klass, a professor of journalism and pediatrics at New York University. Dr. Klass has written a perspective article about seeing hospital weekends through a patient's eyes when her mother became ill. Dr. Klass, going back a bit, can you describe the sense you developed during your residency training of what physicians saw as appropriate and acceptable weekend care?
I think what I felt as a resident was that it was sort of heroic to be there on the weekends at all, that we were keeping things going, holding things down, stretched a little thinner, of course, but that whole residency ethos that I remember so well, where the attendings would come in for weekend attending rounds, and it was almost an obligation to bring donuts or to bring bagels or to bring some kind of treat, that was the attendings' way of acknowledging that we were all there kind of above and beyond, that we were really kind of heroes to be there working as we were, covering when things were in fact thinner. And I don't think I saw it at all as something that would be upsetting to patients.
In your article, you describe how your perception of weekend hospital care changed when your role shifted from physician to daughter of a patient. How did the problem of weekend care first manifest itself? Were there specific instances during your mother's hospital stay where you felt that the care really suffered?
I don't think it was specific instances of the care suffering. I think it was just the sort of inexorable answer. Well, yes, of course, but on the weekends there's only one physical therapist here for 4 floors, so of course you can't get seen on the weekend. We just don't have the staff. Well, if you really want a feeding team assessment, that will have to wait for the weekend. Here's what we can do because we're short-staffed. And it was just the sort of calm, rational answer coming back again and again. Well, yes, of course, but it's the weekend, so that will have to wait for Monday. When, as the daughter of the patient, what I felt was whatever urgency or whatever anxiety or whatever worry or whatever need for help that I would have felt any other day of the week, it just suddenly didn't make sense to me. And then, of course, when it didn't make sense to me, I could hear echoing in my head all of the times that I had been on the other side of it and given that answer as a natural explanation. Well, yes, of course, that's what you need. And when Monday comes, we'll make sure that it happens.
You write about the anxiety that you felt each Thursday and Friday as you tried to make sure your mother got all the tests and the treatment she needed before the weekend started. Was your mother also disturbed by the way things slowed down? If she'd written about it herself, as you had wanted her to do, what do you think she would have said?
I think that one of the things I said in the piece is that, of course, if you are sick enough to be hospitalized, and as she was quite sick and hospitalized for a long time, I don't think she would have separated out this particular problem or this particular indignity. It was that I was kind of in the role of one of the family members trying to help her navigate the hospitalization, and perhaps especially because I was the doctor child, the one who somehow felt responsible for explaining the way the hospital worked, the one who would be in the position of explaining, well, that was the resident, and now the resident has gone to talk to the fellow, and later on we'll see the attending, and that I sort of understood the hospital structures, and it was my native ground that I think made me particularly aware of why you need this and you can't have it, why you need that and you might have to wait. And as I say, I think part of my anger and part of my frustration with this was an awareness that I had in my life been many times on the other side without ever seeing it this way. And I think that I was perfectly aware that this was routine, that this was something that happened in good hospitals, that in many cases doctors who I thought were doing a really good job and I liked and I cared about, and yet there was this sort of blank feeling of, well, how can you tell me that of course she needs that, but it's Friday and it's too late to get it done today, so we'll do it on Monday.
You cite a few studies that have found poorer outcomes among patients who are admitted for medical emergencies during the weekend, appendectomies, pulmonary emboli. How big is the weekend effect? What difference does it make?
Well, to be honest, I hadn't really known about the weekend effect, or I hadn't really thought about the weekend effect. And then I had experienced this from the side of being the family member when my mother was sick. And last summer, I saw this big study of these routine surgeries in children, which cited the weekend effect. And I looked at it and I felt this powerful, righteous response. Look, there it is in the medical literature. It's really true. It's not just that as a patient you might be irritated or as a family member you might be anxious about it. It's actually documented. Care suffers. So then I started reading a little more, and I found that there was, in fact, a fairly extensive literature, as you said, documenting a weekend effect in people, mostly adults. This notable thing about this study was that it had to do with pediatric surgery, but documented effects in a number of conditions, that the outcomes are worse for people who have in-hospital cardiac arrests on weekends, for people who are admitted with a variety of diagnoses on weekends. And, of course, once I started looking at some of that literature, it made sense to me. If we know that hospitals are more fully staffed during the week, and we believe that we do any good at all by being in the hospital and by having staff, it probably makes sense that for at least some conditions, your outcomes are better when things are absolutely as fully staffed as they can be and not stretched thinner. But again, it was one of those things where being on the patient side or the family member side changed what I understood and what I knew about a world that I felt I had lived in for a long time.
Short of major staffing changes, are there any hospital procedures, policies that you can think of that would reduce the weekend effect?
Well, I'm probably the wrong person to ask about the weekend effect as it relates to some of these medical outcomes. I don't know what you would want to do to reduce the weekend effect for some of the surgical procedures or for some of the more drastic emergencies. What I will say is that I think very often when we look at the hospital experience from the point of view of the doctor, we don't fully understand the impact on patients' lives, on patients' families of some of the other services. And, for example, of having a nutritionist or having a feeding team or having a physical therapist, and that it's possible that hospitals cut corners in some of those other services where having a person who's available there every day makes tremendous difference in a lot of patients' lives, in a lot of families' lives. And I think that's always one of the things that you will hear doctors say about the experience of being on the other end. It's not just that it changes the way you look at the other doctors, it really changes the way that you feel about some of those other kinds of care.
Finally, given your recent experience, what advice would you give your resident self and other physicians today about treating patients in the hospital, including on the weekends?
I think this is going to sound a little bit strange, but one thing I would say to my resident self is I would probably say stop expecting patients and their families to understand this and to take it for granted. The number of times that somebody said to me when I was there as a family member, I'm just cross-covering, I don't really know anything about the patients, or I can't make any changes, or I don't want to make any decisions, or we don't have that person there on the weekend, and said it to me not as a kind of an apology or bear with me, but just as sort of a fact of life. Hey, that's how it is, that's how we are, as if I was supposed to say, oh, okay, well, that makes sense then. And I think that I would say to my resident self, if there are situations in which there's something that it would really be better if you could do it today and you're not going to be able to do it today, you apologize, you acknowledge. You don't sort of hand it over as, hey, fact of life, I'm here, I'm covering, I'm doing my best. It's not how it feels from the other side. I think the other thing that I would tell my resident self, and you probably can't tell your resident self this often enough, is being there on the weekend didn't make me the hero of the story. It was good that I was there, and it was sometimes hard to be there because, of course, I did have my own life. But that I was there on the weekend and working on the weekend didn't change the fundamental equation of the hospital, which is that the other people who were there, the patients and their families, were the ones who were really sick or really scared or in great distress. And it's maybe especially important for me to have been able to remember that on the weekend, that extra hard-working, donut-deserving step of being there and covering didn't change that fundamental imbalance, that I was there because I was working and learning and doing my job, and they were there because they were sick or hurt or scared.
Thank you, Dr. Klass.